There are different triggers for each person. And sometimes it's just sound, sometimes it's noise, sometimes it's the lights, strobes, blinking. And that's why you will notice some games or some videos or some movies will have a warning. Okay, like in theaters, sometimes they have a warning, especially if some parts of the movie will have those effects, lighting effects. Okay, it's very important that we warn those people. Okay, autism. Okay, people with autism, they have to be warned too, because sometimes it triggers them. Okay, it triggers them too. Remember the rapid firing? It's not just for seizures or epilepsy. Okay, so what else did you notice? Ty, you said you because you work in a hospital. Okay. What did you notice? Put them on the side. Like I said, back in the day, don't put anything in their mouth. Because back in the day, we put like a wooden spoon for them not to bite their tongue. No, okay? There should be airway. Like I said, many people, many patients who experience seizures since they were young, they already know what to do. You just have to give them space. And then picture this. Those are electrical impulses. Think about you getting electrocuted for about a minute. How would you feel after? Very tired, drained. And that's why they look very tired and drained. And sometimes it takes them days to recover or even weeks to recover from that. Okay. Even if it's just a minute or 30 seconds. And we're going to talk about the different types of seizure. Convulsions. Convulsions are also electrical firings involving contractions. Loss of control of movements, distortion of senses. That's why sometimes when they wake up, they didn't know what happened. And we're going to talk about the different types of seizure. Okay. They didn't know what happened. Some pass out, some don't. Some are conscious, some are not conscious. That's why there's different types of seizures. Epilepsy, on the other hand, is a neurologic disorder of sudden and recurring seizures. So this one is recurring. A convulsion is just like that particular moment, that particular attack. That's a firing, electrical firing. But when it's recurrent, now you're considered, okay? I've had a good number of students who had epilepsy growing up. And so I appreciate these things. Why? It's better that I know, so I know how to handle the class. I give you warnings about the lights or what we're gonna do, if we're gonna do something physical or something that I was thinking may trigger you.
I've seen some videos of where people trying to bring awareness to some seizures, and I don't know the names of it, but they are awake and aware, but they become totally paralyzed. They can't talk, they can't move their fingers, some can only do
After the seizure?
during it as well.
And during it, okay.